Good evening. Today we will be going over healing times and how long you can expect injuries to take to heal. But first we will wait for a few others to join us before we get started. Hello to the few that have just joined. Sorry it's a late one tonight. You can watch from your sofas and from your beds. Fab. So we will get going. We've got a very busy week at the On Your Game clinic this week because we've got a mixture of obviously all of our patients that we normally see, plus we are heading up the physio side of Rosslyn Park Sevens. So for those that don't know what that is, it's the world's biggest under 18s rugby tournament, rugby sevens tournament, and we are in charge of the physio aspect of it. So it's busy between everything going on. But today we're going to be doing a live on healing times and how long different injuries you'd expect them to take to heal, what other things impact healing as well. I wish it was as straightforward as you get injured and then it's better, and it takes however long it takes, but that's not the case because everybody's different. Our nutrition, our sleep, our general recovery, how diligent we are with doing what our physio has told us. So we'll be going through all of that today. As always, if you have any questions, you can ask them at the time, you can save them up and ask them at the end, whichever you would prefer to do. So healing depends on a lot of different factors, and one of the main ones is what tissue type is damaged. So as physiotherapists, the main things that we look at are muscles, tendons, ligaments, cartilage, and bones, and they all heal at different rates. I'm just going to put my phone on silent so it doesn't bother us. So they all heal at different rates and in different ways. So I'm going to firstly talk about muscle injuries. So a muscle injury, for example, would be like a muscle tear, muscle strain. You might get this if you were sprinting. You might suddenly tear a quadricep or a hamstring, for example. You might push off whilst you're playing tennis and tear your calf. You might tear your bicep in the gym. So it can happen to pretty much any muscle in the human body, but some muscles are more susceptible to injury than others. And the first thing to note on this as well is that we don't, any soft tissue injury like that, that's happening as a result of us running or changing direction or lunging. All of that is preventable. If that's happening and there's no sort of real contact or trauma happening at the same time, that's a preventable injury. So muscle regeneration normally starts during the first 4 to 5 days after an injury, and that regeneration actually peaks at about 2 weeks post-injury, regardless of how bad that injury is. And then it gradually diminishes over the next sort of 3 to 4 weeks after the injury. But we have 3 main phases of muscle regeneration, so muscle repair. And our first phase is a destruction phase, and that comes just after our initial sort of inflammatory period that we have. So if you've ever torn a muscle, then you'll know that feeling, 1, of pain, 2, probably heat, swelling, all those kind of things that we associate with inflammation, maybe a bit of bruising too. But straight after that, we get a destruction phase. And then following that, we get this activation of the satellite cells in the area, which basically just help with starting the remodeling of that muscle and the regeneration of the myofibers. So they are the fibers that make up our muscles. So we would anticipate what we would call a low-grade muscle injury. So anything with sort of less than 5% of the fibers torn, we would typically expect it to take about 6 weeks to heal. A medium grade, we'd say 12 to 16 weeks, and a high grade or a rupture, then it's always going to be kind of 3 months or more. With ruptures, it depends what's happened as to what our management's going to be and therefore how long it's going to take. So a rupture just basically means it's a full thickness tear. Sometimes this can happen at the origin of the muscle, so where the muscle starts, so sort of very high up, or it could happen in sort of the middle of the belly or the muscular tendinous junction. So our muscles are their weakness when they're turning from a tendon into a muscle, basically. But so if we've had what we call an avulsion, this is where the muscle has pulled off from where it attaches to, and it normally takes a bit of bone with it. Actually, the surgery for that sometimes isn't too bad. It can kind of almost stick it back on, pin it back on, and that can normally take 3 months. But for anything that's kind of more mid-belly or mid-portion of a muscle, it's going to take quite a bit longer than 3 months. You're probably looking at being out for near 9 months to a year with an injury like that. So quite a long time. But what's really good about muscles is they have great blood supply, and that's why if you ever see sort of anatomy posters, muscles are always in red, and that's because they get such a good blood supply. So with a good blood supply, we get really good healing because it brings oxygen, it brings nutrients, and it helps flush out any of the stuff that's been sitting in the muscle that we just don't want to have there after an injury, like dead cells and that kind of thing. So then our next sort of tissue type is tendons that we tend to look at. So tendons attach bones to muscles. They are what join them together. They do not have a particularly good blood supply in comparison to muscles, so this does impact their healing. But when we're looking at injuries to tendons, which I've sort of mentioned this before, so if you want to be tagged in the previous live that I've done on tendon injuries, then just comment here and I'll tag you after. We initially have this reactive phase of a tendon injury. Normally, if it's going to be a chronic injury, we get a reactive phase first. And this is where we're aware that something's not right. Maybe you went on a longer run than normal, maybe you wore different shoes, maybe you ran on tarmac and you normally run on grass, and your Achilles might feel a bit sore. That's a reactive tendon. That's your tendon telling you, look mate, we've done too much, we need to calm down a little bit for the next couple of weeks, and then we can reset again. And in those cases, I'd expect it to be around 2 weeks if you manage it properly, you let it settle, and then you gradually build up your activity again. I'd expect it to be a couple of weeks. But tendons that are in disrepair or they're sort of very degenerative, they're typically going to take longer to heal. And often in this phase, which is a phase that we see after reactive tendons, this is when we've kind of ignored the reactive tendon, we've let it get into a bit of disrepair, so a bit of damage, and then we're in our kind of degenerative stage. Typically there, if you've had it for 6 months, it's probably going to take a similar amount of time to go. Hopefully not as long as that if you're doing everything right, but we do tend to see that those longer, more chronic tendon injuries do take a while. If we're thinking about tendon ruptures, so for example, like an Achilles rupture is a common one that you may have heard of. That is the tendon that runs behind the back of your ankle. We'd normally be looking at a year for healing. And some people will have this operated on, some people won't. It depends how large the gap is between the two bits of tendon that have snapped, basically. Smaller the gap, if it's smaller than about 10 centimetres, so kind of, not 10 centimetres, sorry, 1 centimetre, 10 millimetres. Smaller than that, then often they will not have it done surgically. If it's greater than that, then they will have it surgically repaired, but either way, recovery time is fairly similar, 9 months to a year, depending on kind of how much you do. And the thing to note sort of about things like that as well, and kind of any of these injuries that we typically see, the more you're going to commit to doing everything that a physio or a sports rehabber tells you to do, and the quicker we're going to get better, but we'll talk more about that in a bit. When we're thinking about cartilage, so cartilage covers bones, it's there for shock absorption, it's there for protection. It helps sort of the bones slide and glide along each other a bit better because you don't want bone rubbing on bone, it's just going to wear away. So our cartilage is really important for shock absorption and just for general protection. But what we see here is a real lack of healing, and the reason for that is that the blood supply, again going back to blood supply, just isn't as good. So without a good blood supply, it's really hard to get cartilage to heal. And actually one of the methods that's used in surgery is to drill little holes into the bone to create a bit of bleeding to help with cartilage growth and repair as well, should you need to go down the surgery route. But the lack of healing and regeneration that we see in cartilage due to the lack of the blood supply does cause a problem. But actually we have seen that healing does take place. But what's interesting is sort of the repair tissue that can restore articular surface. So that's like that cartilage that's damaged, when examined, kind of initially appears normal. But when you take a deeper look at it and you look at the repair tissue, it does not actually look the same as normal cartilage. So the structure, the composition, the material properties of it are not the same as normal cartilage. So although it might heal, it's actually not the same, and it's not going to work in the same way. So typically when we've had sort of cartilage injuries, if it's a minor injury, if we've had maybe a little bit that's chipped off, we've got a little tear in a bit of cartilage, if we're able to manage that conservatively, you're probably looking at around 3 months-ish, maybe slightly less. For larger tears, you could be looking at 6 to 9 months and possibly surgery as well. particularly sort of seen around knees and shoulders quite typically, particularly if you've had a shoulder dislocation, our labrum, which is this cartilage that sits in the ball and socket joint that helps not only give us shock absorption protection, but it also helps like sort of keep the suction of our humerus and our shoulder girdle. But when we've had a dislocation, that suction's disrupted. Sometimes there's a tear in the cartilage. Often that does require surgery because bits of it might flap over, it might get in the way when you're moving your shoulder. It can be very painful, and also it's reducing the stability of the shoulder as well. So yeah, typically we're looking at, for an operation, a few months, 6 months normally, sometimes less, but around that. And moving on to our last structure that we're going to talk about today, ligaments. So our ligaments attach bone to bone. And this, you might injure a ligament, say you rolled your ankle playing tennis or falling off a curb, or drunken heels falling downstairs. That's something we do see a lot in clinic. The acute inflammatory phase and the proliferation regenerative phase that we tend to see, we sort of get for around like the 48 to 72 hours after the injury. We get this inflammatory phase. So that's when your ankle, say it's your ankle, becomes big, fat, swollen, bruised, starts looking like a tennis ball stuck on the side. And during this phase, the blood collects at the site of the injury, which is why it often feels kind of firm and sore, and you get all that bruising. And we get lots of different cells that are kind of interacting within the matrix to change their shape and initiate clot formation, because we want to have a bit of clot in there so it's not just continuing to bleed. But what we see over the next few weeks as our ligaments are healing is that their cells deposit lots of different types of collagen. So collagen is there for growth and repair. We also have it in our skin, in our hair. You've probably seen supplements for it to make you look beautiful. Same thing if you were to have fillers, that's collagen as well, but it's there for scar tissue formation. And the collagen eventually becomes aligned with the long axis of the tendon. So if the tendon is running vertically, the collagen is going to become aligned with it, like that. And it's going to help form sort of the new ligament during this time. However, the newly formed collagen fibers that we tend to see, they're abnormal and they're smaller in diameter than normal ligament tissue. So you may have found that you've previously had, for example, an ankle injury, and you now just feel like it's still a little bit unstable. Maybe you didn't do as much rehab as you could have done. One of the reasons for that kind of instability that you still feel is because although the ligament hasn't actually repaired fully and it's not the same as it was before, with our rehab, what we're doing is almost trying to compensate for that by getting other muscles in the area stronger, by getting our proprioception, our joint sense of position stronger and better, so we can accommodate for that ligament not being as good. And that's something that we have to do because our body isn't great at kind of repairing this as it should be. And interestingly, actually, when you investigate a ligament after it's kind of healed, what's actually formed, where the collagen has tried to form kind of new ligament tissue, it actually looks very similar to scar tissue in its makeup. And it's sort of even fully remodeled, so when it's at the end of its healing phase, scar tissue remains grossly, sort of microscopically and functionally very different in its function to other tissues and to normal tissues. So what you end up with then is a ligament that's actually got a bit of scar tissue on it, just to kind of help bind and keep it together, but the ligament isn't healed. But actually this whole process for ligaments takes months or years, and the amount of times, and I've actually done it myself, where someone's rolled their ankle and it's not that bad, I'll just strap it up, and they go and play rugby or they go and play netball the next week. It is not good for you. You are making it worse. You need to have proper rehab for something like this. I said ligaments are going to be the last one we're looking at, but we are actually looking at bones as well. So looking at bones, we initially see within the first 5 days a big formation, hematoma formation, big bruise basically, within the area. And then we get sort of this fibrocartilaginous callus that forms within the bone, just so that everything can start remodeling, so that we can start getting a really good bone structure down. And from there we get a bony callus, that's about 11 to 28 days, so about kind of 4 weeks later. And then we get bony remodeling, which everyone's like, oh, it happens in 6 weeks, like you've broken your bone, you'll be fine in 6 weeks. That actually takes years. So that starts happening from day 18 onwards, but it can take years because it takes a really long time to lay back down our calcium and our potassium like deposits that sit and phosphorus that sit into our bones. It can take a really long time. And failed or delayed healing can affect up to 10% of all fractures. So 1 in 10 people, or 1 in 10 fractures may be subject to a delay in healing due to various factors, sort of like comminution, infection, tumour, and disrupted vascular supply. So comminution, which I struggle to say, is basically just where the bone isn't healing properly, and you might have possibly a fracture where something is slightly away from the main structure of the bone and it just isn't coming together. So looking at all of these things that we can have happen to our bodies, there are things that we can do to help and to help speed up these processes so it's not taking you years and months and stuff to get better. And the first one is how diligently you're sticking with your physiotherapy and your rehab, and if you're even doing it, because so many people don't. Like my example of the ankle injury, they're just like, oh, I'll just strap it up next week, it'll be fine. You are then leaving yourself open to kind of lifelong issues potentially with that area. And what we typically see as well is people ask us, oh, I want an exact time frame for when my injury is going to be better. How many weeks is it going to be? And I feel like with working with the public, that's kind of, how long is a piece of string sometimes, because we are only in control of what we do with you when you see us. So typically you're seeing us twice a week and we can have kind of complete control of what we do in that session and what we're doing with you. What we can't control is what you do outside of there. So we can't control your sleep, your eating, how often you're doing your exercises, how often you're aggravating the injury, even though we've probably told you not to. And all my background's been in professional rugby and professional sport, and we would have to put a timeline on it. The coach would say to us, right, what game is this player going to be back for? That's how they did it. It wasn't weeks, it was games. And I'll be like, oh, okay, well, they'll be back to play Jersey in 12 weeks time, because I can sit there and I can work it out. Because with those players, I'd be with them 5 days a week. I see them more than they see their wives, girlfriends, kids, everything. And everything is about how can we get this player back quicker. So we're doing pull sessions with them, we're doing cardio sessions with them, we're doing their rehab with them, we're doing soft tissue work with them every day, we're getting them doing, eating properly, sleeping well. We can kind of really control everything they do, which means that I can almost guarantee a week when they're going to be back, provided, if they've had surgery, we don't have any infections or issues like that. I can pretty much put a week on it, but we can't control all of those things within sort of the confines of the clinic. So we as clinicians rely on you as patients so much to do everything that we've told you to do so that you can get better quicker, because then we can put a better timeline on it for those that are kind of a bit better with adherence. And it can be really tricky trying to balance family, work life and rehab. It's completely different to being a professional athlete where you don't have to think about all of those things, because that job is to get better. But that's one of the main things that we need to look at. One of the other things that is really important is sleep. I think a lot of people don't get enough sleep. On average, people in the UK are not hitting the recommended 7 to 8 hours a night of sleep. And actually what you're doing then is just delaying your recovery. So if you're not sleeping well, not only are you going to be low in energy the next day, and maybe you're then not going to adhere to your rehab as a result, you're opening yourself to a higher risk of injury anyway by not sleeping. But also, we recover in our sleep, we recover when we're resting. So human growth hormone, which helps us grow and repair, is released at night. It's released at night when we're sleeping. So if you're not sleeping or you're not getting enough rest, you're not going to get the release that you need. And then that's not going to help you with your healing. So that is just something else to consider, that when you're injured, take more time to sleep. And also, it can be hard with an injury. Sometimes you can't sleep. If you're in a boot, and you've got to wear the boot at night, trying to roll over with a boot or like a knee brace on, it's going to wake you up every time. And one of the questions that we always ask people when they first come into clinic is, how is your sleep? And I mean that from the perspective of how much pain are you in when you're sleeping? Are you waking up and you're waking up because you're in pain and you're having to roll onto the other side and that kind of thing. But also just generally, like, are you a good sleeper? Do you have insomnia? Do you struggle to get to sleep? Do you struggle to stay asleep once you're asleep? Are you waking up too soon? Because it is such an integral part of the rehab process. The other thing as well is nutrition. So I think the tendency is sometimes when you're injured to think, okay, well, I really need to eat way less because I'm not doing all this activity that I was doing before, and therefore I don't want to put on weight. And to a certain extent, that's right. You want to be kind of matching your maintenance calories, although there's always loads of stuff that you can do even with an injury. We just need to change up the approach. But if you're sort of dieting or you're cutting your calories down, what you're going to notice then is that your body is not going to be able to heal as quickly, because your body needs to have calories, it needs to have nutrients to be able to grow and repair. So if you're not giving it that, your body's not necessarily going to say, well, okay, your hamstring's injured, so we're going to send all these calories to your hamstring to get fixed. That's not how our body works. It prioritizes, and your hamstring's not going to get that priority. So it's important to make sure that you're at least sticking with kind of your maintenance calories, so that you can use that food to get you nice and better. But also you want to have that food obviously good quality, lots of fruit and veg, lots of protein, good amount of carbs and fats, just a really nice even diet, not trying to do anything silly because we're injured. And the last point that I wanted to make as well was mental well-being. So those that are struggling with depression, anxiety, any other kind of sort of mental health conditions, then what often happens is you experience pain on a worse scale. It is more intense than those who aren't. And that's actually the same with people that aren't sleeping that well as well, actually. And this can prolong your injury recovery and can result in chronic pain if left unmanaged as well. Because what happens if we're in that kind of anxiety and depressed mode, then our body is going to say to our brain, look, this is painful, this is painful, this is painful. And we're going to then end up in this cycle, this kind of pain cycle where, you know, we think everything we do is going to make it more painful. Our brain's telling us that what we're doing is really painful, when actually maybe it's not as painful as our brain is telling us. And so we just end up in this awful cycle of being in pain and not being able to get rid of it, and then end up in this chronic pain cycle. So it's really good to be able to address your mental well-being where you can. Again, something we always ask in our first appointments with patients is, how are your stress levels, anxiety, things like that. And we always do a medication review question as well, just so we can see, are you on any medication for this? Where possible, obviously, we will manage it with you. Sometimes we need to refer on to GPs as well, who can offer you some other advice too. But that's just another really important point to mention as well. So as physiotherapists, as sports therapists, we want to manage you holistically to cover all of the points above to get you physically and mentally better. And we offer like PDFs for nutrition, for sleep, and just letting you know like how much this can help your recovery. So that's everything that I wanted to say on the matter for today. If you've got any questions, just comment them and I will answer them. And if you think of any questions after, then just let me know. Of course, if you've got an injury that maybe isn't healing how you would want it to, or you've just got injured and you want the healing to be ASAP, then just drop us a message and I'll let you know how we can help you. We can get you booked in so that we can do all of that with you. Fab. Any questions, let me know. Fab. Don't think there's any questions. So I will see you in my next live in a few weeks' time. Have a lovely evening. Thank you so much for joining. Bye.